week. We have Mac, myself, Jennifer, Darien. TV is on. Greeting Jim, Andy, and I assume Christine is caller 2. Is that, Christine, are you on?
No, I'm with Jennifer. Is that on caller 2?
Oh, yeah, okay, fair enough, fair enough. Good,
Okay.
good, great. Greetings, everybody. This is the Tuesday, the 15th, 5 p.m. This is the last Advisory Board of Health meeting for 2020. 2 orders of business before we get started. The first is approval of 2 rounds of minutes. David circulated earlier some 2 rounds of minutes. Anybody have any comments, additions? Okay, great. Thanks. We will take that as a no, and David will put those 2 docs into minutes on the website. And then I will, no further ado, hand it over to you, David.
Before we do that, we need to set our schedule of meetings for 2021.
Right. Okay. Let me give me 1 second. Let me grab my calendar. I did look at that. So going through kind of the schedule, we're doing the 3rd Tuesday of the month. Where did I write this down? Correct. So it's the 3rd Tuesday. So going by that, it would be, David, it's always around our birthday.
I know.
It would be the 16th of March. The 15th of June. In September, it would be the Tuesday the 14th. And then the December meeting, obviously would be the last meeting, would be Tuesday, December 14th. I will, of course, write this all up and send it to the group so that we'll have them. 5 o'clock work for everybody?
Works for me. Yeah.
Okay. Okay, again, apologies for the confusion around getting this one done, but thank you all for joining. I will send out that information after this meeting. David, go ahead.
All right. Well, good evening, everyone. Welcome to our final meeting of the year, as Kevin said. 2020, can't wait till it's in the rearview mirror, just like everybody else, I suppose. A couple of announcements I want to make regarding staffing. We have a new interim medical advisor. We actually are combining and working with the current medical advisor to the Board of Education, Dr. Kenefek. It definitely streamlines our approach, working through this whole COVID crisis to have the same person providing medical guidance. Caleb Moore, been excellent, been great to work with. Tim is actually serving as interim. It's not necessarily a full-time appointment, but it's really designed to get us pretty much through this COVID crisis situation, so that we're consistent in our approach to dealing with this from a medical advising standpoint. So, thank you to Tim for agreeing to participate. We also have added a new part-time nurse for contact tracing, interviewing positive cases, and data management. Cindy Rogers, who is retired school nurse. She's got a long history here in town, so she's really involved and engaged with the community, and I think she's going to be a real asset, and has been already, huge asset to helping us do our interviews and contact tracing. locally. She's also going to take over our posting for our weekly summaries, data summaries for COVID, which I'll post and show in a few minutes. A daunting task, and that's because Michelle, who is our office administrator, is going to be on maternity leave beginning any moment for the next 4 months, and we wish her well with her new package in life. And one final note I'd like to make regarding staffing is Mindy, our sanitarian here, was awarded Sanitarian of the Year by the Connecticut Environmental Health Association due to her great work in the past few years, not only serving as president of the organization, but ushering in some statewide regulations, really in large part through her efforts that deal with licensing of cosmetology salons. That was a huge accomplishment, and she's instrumental in making that happen, and very deserving of that award. So congratulations to Mindy. So shall we talk about COVID? As you know, the town has been, I would say, a leader in providing COVID testing opportunities for residents. And we have the testing facility in Leroy West parking lot. We've changed providers since the last time we met. The services are now being provided by Everpoint Health. And this now enables the testing to be done 6 days a week. It's still by appointment only, but expanding the capabilities of the service to pretty much every day except Sunday is huge. And at this time of demand, they've been busy. They're busy every day. The important thing is it's not a network provider who was selected after several other options were examined. We didn't want to have a big gap in service because of the demand, but there were no other providers who were willing to run an outdoor drive-through testing facility such as Everpoint. And I encourage everybody to go take a drive by there and see this operation. It's definitely first class. It's big, and the capabilities are significant. They can do a lot of testing there, and they've been doing a great job. Great to work with those folks. I'd also like to take this opportunity to introduce those of you who don't know Nick Jossam to Nick. Nick, I don't know if you have camera capability, but if not, Nick is serving anyway as our emergency preparedness consultant and has taken on really coordinating our role regionally and statewide in responding to the COVID in terms of clinics, PPE. He's been great at getting the PPE to us. He's been a tremendous help, and I'd like you to have Nick explain a little bit about where we are with our clinic planning. I can't tell you in recent days now with the announcement that vaccine is now available, how many times I've been asked, what's the availability, who's going to get it, and when? And so I think that Nick can help explain some of those questions best of our knowledge and ability at this time in this ever-changing environment. And with that, welcome and thank you.
Thank you, Dave. So where we stand right now, Pfizer vaccine has been approved. It has started coming out to the hospitals. I know that Yale received 1,900 doses today. Last I heard, state of Connecticut is receiving 31,000 doses this week. These first initial doses will be coming out for our healthcare providers, our long-term care facilities, and our assisted living facilities. The number of people that's been out there who need their first dose is about 340,000. So if we take that number and double it, we're looking at 680,000 doses just to take care of our healthcare providers, our EMS, our assisted living, our long-term care facilities. You've seen in the news, Moderna is hoping to go through the same process that Pfizer did last week and be approved. And the state is already preparing to take possibly some of that next week. The Moderna vaccine will also be going to hit our healthcare providers first, as that is part of 1A, which is the grouping that has been put out by DPH. So once we get through those 680,000 people, we'll be starting to move into more of our critical workforce, which would be town employees, local health departments, MRC members, CERT members, fire department, police, and those critical workforce groups that have been designated by DPH. And that does include our Board of Ed, teachers, school nurses, administration. Also in that number would be our licensed pre-K facilities in Darien. Dave and I have had several discussions on where we are going to be able to give these vaccines. Initially, they are probably going to be small amounts. So we may be able to go directly to, let's say, the fire departments and set up there and have their members come through there. Otherwise, we have looked at the Mather Center. We've looked at the gymnasium at Town Hall. And then if we can even fall back to our main pan flu mass vaccination plan of using the Darien High School if school were out of session. And I know there's going to be some talks with Dave and the gentleman, is it Dr. Moore?
Yes.
Dr. Moore, who's running the COVID testing site at the Leroy West parking lot, and possibly be able to use that as a vaccination site also. As far as personnel, we'll be using not only the part-time and volunteer nurses that the Darien Health Department has. The school nurses have shown an interest. There will be a discussion in the very near future. Dave has put together a vaccine committee. We should be meeting shortly and be working out details on who will be able to help us in those endeavors. The state has approved for our EMTs with Darien EMS to be able to help vaccinate. I had a discussion with Joe Larchovic yesterday, and he has personnel there that are interested in also helping out. On a regional level, I'm also the regional coordinator for here in Region 1 of Connecticut. And myself and my partner, who also works as regional coordinator, Sue Giacozzi, have been working for months with a small group of individuals to put together regional strike teams. And these will be for numbers that maybe the health department can't handle on its own. And so those will be available to all our regional partners. So that's like all the local health departments. So that's about where we stand on vaccinations.
Right, great.
Hey,
Thank you, Nick.
Yeah, I can.
Questions for Nick?
Go ahead, Kevin.
sorry, thanks so much for that, Nick. When the vaccine gets more widely available for general public, has the state given any guidance on how that's going to roll out? Is it going to roll out via healthcare providers and pharmacies, and or do you see a role in the town filling any gaps, kind of like we do in flu season, in us delivering vaccine to the general public?
There's no definitive answer for that yet. I believe DPH is still working on that. I understand that the governor's office is working with the CVS's, the Walgreens, to possibly be able to do vaccinations from there. They may be able to push it out to our doctor's offices. So just like, you know, being able to get the flu vaccine, you may be able to go to any of those facilities to get a COVID vaccine. In our plans, we are planning to do just as we would with the flu, to do 10% of the population. If we needed to do greater numbers, then we would, you know, our plans are flexible enough to work around that.
Okay, good. So really kind of just depends on the guidance coming from the state and how they envision it rolling out, and will adapt accordingly.
Correct.
Right. Yeah.
Okay.
Until a couple of weeks ago, we weren't even aware that CVS and Walgreens were going to be taking on the size chunk of the project that they are with doing the extended care facilities and assisted living. So that was news to us when that announcement was made. We weren't quite sure how that was going to happen, but that simplifies things too for us.
Indeed.
Yeah, and thinking of that general population that'll come, you know, as we're seeing on the news, they're saying spring, maybe early summer. You know, we're already going to have our critical workforce numbers done. This doesn't include the population of 16 and under. There's not enough data on that yet. So our population is already starting to get smaller. Your population of your nursing homes, your healthcare providers, your doctors, everything else, they're already going to be out of the mix. So if you take the number of, you know, 21,000 for Darien, you're cutting that number down quite a bit between now and then. So it won't be your whole population when those vaccines come out. And they're not going to all come out at once either. They're going to be staggered like they are now.
Understood. Okay. Appreciate it, Nick. Any other questions for Nick?
Yeah, it's Andy. I just have one question. To get a test at the testing site, do you need to be having symptoms, or can you go whether or not you have symptoms?
You do not need to have symptoms. The only symptomatic based testing that is recommended is if you have symptoms and you want to know right away, we recommend an antigen test. But antigen test only if you're symptomatic, because you'll know right away if you're COVID positive.
Okay.
But yes, you do not need to be symptomatic to get tested. That's the beauty of having it there to do the PCR test associated with traveling. So, so the answer is no. You don't need any. You don't need to be symptomatic.
All right. Thank you.
You're welcome.
And there's no. I would imagine, you know, of course the first priority is getting the Moderna vaccine. I'm sorry, the Pfizer vaccine, followed very shortly by the Moderna, and then there are a couple probably other vaccines in the pipeline. I don't know how close they are to getting emergency use authorization, but I would imagine that by springtime, it won't just be Pfizer and Moderna, right? We would expect that there would be some other vaccine manufacturers entering the game.
We would think that other pharmacies have had some vaccines available by then.
And we're seeing, I'm just kind of trying to cover off a couple of the questions that we saw. David, we've seen that the efficacy of both using the data we have is around 95%. So we can't say one is essentially better than the other, right? At the moment, using the data, the kind of limited sample size that we have.
That's correct. The only difference is that Pfizer has different handling requirements. It needs to be kept in a very, very low temperature. So it restricts who can actually receive that particular type of vaccine to hospitals that already have the type of freezer capabilities that are needed. So the Pfizer product likely will not be available to general clinics such as ours, such as any that we would stand up, because we're not going to go out and spend the amount of money for those specialized freezers when there's other vaccines available that can provide that same coverage. The one thing is that if you get a Pfizer vaccine as your first dose, and this is a 2-dose administration required to get full protection, you still need to get the second dose of Pfizer as well. So they're not transferable. If you get one shot of one kind, we have to make sure that folks are getting the second of the same vaccine. But the efficacy of the two are at least right now shown to be equivalent, and also that there's the side effects. Some people are reporting there are side effects. People are feeling not so well. In some cases, I heard as many as 15 to 20% of folks who get vaccinated have some response to it, but it's not significant, and it goes away within a day or so. But just to know that there are reports of people feeling lousy after being vaccinated.
Okay,
and that is something that we'll keep in mind when we start doing vaccinations for the PD, EMS, and fire, so that we're not, taking out a whole shift at once.
Yeah. Okay. And then let's just cover off 2 other pieces just quick. There's a lot of safety and efficacy data out there. I'm sure that we will get more as people get the vaccine. David, when you give the flu shot, right, we give them some safety information as well if they want it. So I'm sure there was more to come on that, including information about, and this will be kind of I would imagine you're going to have a little triage questions, just like you would for the flu shot. Am I feeling unwell today? Do I have certain medical conditions which you would have to be careful about before you get the vaccine, just like you would a regular flu shot, right?
Absolutely.
Yeah, indeed. Okay, and then
Sorry, Kevin.
No, go ahead, Nick.
I believe that's going to be part of the registration process when our critical workforce members are asked to sign up for the COVID vaccine. I believe it's going to be part of the whole questionnaires when they sign up.
Yeah, I just want to be clear that you're not going to stand there, get a shot, and leave. Right? There's going to be some paperwork and information that you're going to have to fill out and attest to before you get it. And I guess the last piece is, Nick, is there any thought on once somebody does complete their round of vaccines of any just because you received the vaccine doesn't necessarily mean you're immune, but is there any thought to any kind of information that you would get that that says that you have completed your series?
That's a good question. I know it's been mentioned before on CDC calls, but they have not given out that, I think you're referring to, some type of card that was done years ago, but nothing definitive yet on that from the CDC.
Okay, I do know when you get a flu shot, you get a little receipt that says on this date I had the following immunization. So okay, all right. I think there's still some guidance to come down, and then the last 2, David, are any virus mutations. I think it's just too early to say if and when we see any mutations in the virus, whether this vaccine will still be there's some efficacy there. We we just don't know yet, right?
Yeah, that's always the concern, is that the virus will stay ahead of the vaccine. So we're hoping that's not the case here.
Indeed, indeed. And then I did see very recently, and David, keep me honest here, that the CDC has come out and said that if you have had COVID, you are thought to be imparted with some kind of immunity for 90 days only, and even with contact tracing, right? So that 90 days to the positive test. After that, you're not necessarily thought to be immune. Have we gotten any guidance on getting the vaccine for people who have already contracted the virus?
I believe the guidance is, I haven't seen it in writing yet. I've heard it on calls that even if you have had COVID, to still get the vaccine.
Okay. Okay. All right. More data to come on that piece. Okay. So I think we covered a lot of the information on vaccines. Obviously, before the general population comes, there's going to be a lot more data information coming out from both the CDC and the state on who and when, and the town is prepared for that. Okay. Thank you. Any other questions for Nick?
No, but this is Christine. I did read that people who have had documented cases of COVID, although they may be eligible for the vaccine, would be on a lower priority compared to everybody else who's not been exposed.
That does make sense, and I think it's just kind of putting some time parameters around when, right? Yeah. Okay. Great. Thank you very much, Christine.
You're
great.
welcome.
Anything else? Okay. Nick, thanks a lot, pal. Thanks for all your hard work, and look forward to working with you on the vaccine piece. David, over to you.
So can you see the, are you seeing the screen that I'm showing, the coronavirus update?
Can indeed, yep.
Okay, so what I'd like to do is quickly go through that. This is as of Friday, last week. And on this slide, you can see how if all the way to the left is springtime, summertime, and then all the way to the right brings us up to current time. So we're in a spike that is similar to, and actually a little bit bigger than what we were seeing in the spring. Of course, we're testing a lot more too. That'll show up later. But here's a month-by-month summary of where we are. As of today, we're at 544 total cases. That was Friday, so you see we're still adding cases considerably. In the next slide, we'll show you just how many tests we're doing. And if you look at November's number of tests that we're doing of residents, now this is number of tests. There are people getting tested multiple times. So, you know, there's retesting going on. Some folks, especially those in our senior house, in our assisted living facilities, are being tested, you know, weekly or every other week. So there's a lot of retesting going on here. But as you can see, the numbers of tests are really gone up. Our positivity rate in the last 3 months has gone up also. So we're getting more positives, a lot of total tests. You know, the positivity rate last month, 3.4% of all the people tested, 3.4% were positive. This is kind of an interesting slide that shows the age distribution. We broke it up in this in 6 month in a 6 month block because we started to see a change in the age groups that were affected to being younger as time went on. So since July and up till now, the number of cases in younger people has increased. It's important to note that, our nurses, as I say, we have nurses doing interviews and contact tracing of positive cases, have indicated that by and large, children, those under 16 years of age and under in our schools, also confirmed by the school nurses, children are generally asymptomatic or they have sniffles or slight sore throat. It is very unusual, and this is a big question that's been asked, how sick are people getting? And good news, if it is good news, I mean, they're positive cases, but the fact is that the younger children are not getting really sick. They're testing positive, but they are pretty much asymptomatic or mildly ill. That does present a bit of a problem if they're going to go visit the grandparents, however, because they may not know if they're positive and could be carriers of COVID, hence the need to test. So, we want to make sure that if kids are going out and visiting families, and this time of year is when families are getting together, we need to be careful with those gatherings and gathering sizes. Of course, the key thing is hospitalizations and deaths. We recently had a death reported over the weekend, so that would be one for December. Prior to that, we hadn't had a death related to COVID since April. Hospitalization numbers as a percentage of total cases is quite low. And it's important to note that the hospitalizations aren't necessarily just because people have COVID. They may have some other issues. They may have fallen. They may have had hypertension or some other reason. And when they go to the hospital, they're tested and they're tested positive. So that number of 21 is not just 21 people who are in the hospital because of COVID. There are 21 people who, when they went to the hospital, were diagnosed as being COVID positive, in addition to whatever other symptoms and issues and health problems they had at that particular time.
So COVID might not be the primary diagnosis on those hospitalizations.
And same with the deaths,
okay.
But that they were positive. So COVID is associated with hospitalizations. COVID is associated with those deaths, but may not be the sole cause of death.
Understood.
This slide is an update of what we've done at the Leroy West parking lot. And you could see again in November, relative to the other dates, how our testing numbers have just gone through the roof. We're testing obviously a lot of folks who aren't from Darien, which is fine. It's a public health matter that we're involved in here. But point is that shows the importance that we have been able to meet the demands, help provide a demand and a service to the community. I know that a lot of other places, people are going to get tested and they're spending 4 or 5 hours waiting to be tested. Here is by appointment only. And, so you get in and out of there pretty quickly. And finally, on this weekly report, which is updated on Thursdays and posted to our website, the town and the health department website, is a link to the school portal that gives updates, and to the state reporting system. This is the current status in our schools. So you see, positive members, a positive individual can have a huge corollary effect. One person can, depending on how they conduct themselves, may end up with a lot of people needing to be quarantined based on that 6 feet and 15-minute level of exposure. So 14 community members in schools have resulted in 168 people currently in quarantine.
Thank you, David. Do we have any data for the positives that we've seen in town or in the state about how and where they contracted the virus? You know, I would assume it's primarily private in-home gatherings.
Well, you know, it's interesting because that has changed from earlier this fall. Primarily, it seemed that that exposures were coming from sports-related activities, resulting in considerable amounts of quarantine. But lately, it seems as though our investigations are looking at and seeing a lot of family transmission. We're seeing cases, you know, more and more homes have multiple cases within them. And, you know, it's been family get-togethers that have been contributing to increasing numbers of cases. I think that the difference now versus in the spring too is that having testing more widespread now, people are more inclined to get tested if there other people in the house are showing symptoms. In the spring, I think it was people more or less just felt, well, if one had it, everybody had it, and testing just wasn't as widely available perhaps then as now, widely as accepted as it is now. Just the testing numbers are higher. So yeah, so the answer to your question, Kevin, it looks like it's occurring from gatherings. You know, people sitting around the table, whether it's at home or in restaurants, large groups at restaurants. You know, that's one of the things that we are very concerned about. In particular, are, you know, gatherings in restaurants. None of us want to see the restaurants closed. You know, it's very important that restaurants and, you know, maintain the ability to function. And but you know, if people are going to go in large groups to restaurants and get together and take their masks off and sit around the table for 2 or 3 hours having dinner and cocktails, that's a bit of a problem. And I think that's where we're seeing a lot of spread right now. And that's what you know, has come to the governor's attention. And you know, as I said, we don't want to end up having restaurants be closed because they're determined to be sources of infection and spreading infections.
Well, David, to that point, are you seeing that in Darien restaurants, or are you just speaking more of the state in general?
I am not talking about Darien facilities in particular. I'm just talking about a general statement because we are not seeing illness in town that's associated with our facilities. You know, so, you know, I can't say that it's happening here. I'm concerned about it on a statewide basis.
Okay.
You know, and that, you know, going to dinner anywhere, you know, whether it's in Darien or Stamford, Norwalk, or anywhere, you know, if there's not adequate spacing, I would be very cautious about going to dinner. And now that with winter here, we don't have the luxury of being able to spread outside anymore.
Mm-hmm.
Great. Thank you. Anything else for David? Let me just see if we got. The state is, in fact, indeed limiting gatherings, David, and that's all covered on the statewide dashboard, correct? What color your zone is, and then
everybody's red now, so it doesn't really matter anymore. Everybody's in the same 2.1, so it's 8 people at a table is a limit, you know, but 8 people is a lot too, you know, and especially if you're not immediate family, you know, so that's a concern. You know, people have to be smart. You know, we need to get through this. There's a vaccine that's coming and it's going to be here soon. We have the holiday season you know, that's here. It's not coming anymore, it's here. So, you know, we just need to be smart and get through this. The next month is going to be a challenge. see what happens after Christmas. And hope we can, kind of patch through to get through when the vaccine is widely available.
Okay.
Um,
And in
David,
terms of if people want to travel, obviously all states have different restrictions about where you can travel to and from. So I, imagine again, the CDC has come out with some guidance regarding holiday travel. In addition to if you're traveling out of state, you have to look about the restrictions coming into that state and also the restrictions coming back when you're done traveling, right? Because there are the restrictions are different, even within California. If you're traveling 150 miles away from your home, you're going to be required to quarantine. So it really depends on the state you're in and where you're going to, what those travel restrictions are like. Either Nick or David, can you give a status on the PPE distribution? I know we were doing back in the spring and summer some PPE distribution to merchants and for first responders. I understand that state program has been halted as of the fall. Is that correct?
That's correct. Though DPH did do a one-time shipment yesterday for Region 1 for local health departments for some of the assisted living long-term care. Specific EMS providers who requested it were notified. But there has not been any determination on whether something will happen after the holidays and go back to a regular basis like they did in the spring and early summer.
Okay, but we, as far as we know, I know I check in quite frequently with Chief Anderson. There are no PPE issues currently for our police department. Do we know of any issues for the FD or EMS?
Joe Larchovic was, excuse me, was at Sherwood Island yesterday picking up for Darien EMS. I cannot tell you about the PD. Not sure.
Okay.
And we also kept some PPE stockpile for us so that when we run our clinics, we'll be fully stocked for ourselves and for any staffing that we're going to have to stand up for that. So we're good to go from this end too.
Good. So at the moment, no issues and shortages of PPE that we're aware of. I think the mask issue has been covered over and over. The guidance is very clear about masks. Obviously, the best is an N95 mask, but that's not really practical for every day. I don't need to go to the supermarket and wear an N95 mask. Those are usually A, more expensive, B, harder to get, and C, we're reserving those for our healthcare workers. But the simple face coverings with multiple layers is what's currently recommended. Okay, I think we've covered many of those, if not all of those questions. David, what's next on the agenda for you?
Well, we're going to, as I say, pay very close attention to any new guidance that's pending regarding, we talked about the travel guidance. We're told by DPH that will be changed momentarily. Could be tonight, could be tomorrow. The other thing is that, as we've all heard, CDC has made some recommended changes to the quarantine guidance. But in Connecticut, we haven't made the changes yet. I know DPH has made recommendations to the governor's office to modify the quarantine guidance to be somewhat more in accordance with what the CDC has said. But for whatever reason, it still hasn't seen the light of day, and DPH is not sharing with us what their draft says, because just on the outset that it may get changed again. So stay tuned for that, because as we mentioned, travel, this is the time of year when people really are on the move. So Connecticut will be changing its travel advisory again, anytime now. And as soon as that happens, we will be trying to get that information out to the public as best we can, maybe through Code Red, but certainly through our website. And same thing with quarantine changes that could affect an awful lot of people. You see that, school community itself, 168, excuse me, that's a big difference. 168 people in quarantine, it may affect a good number of them. So, and now that I mentioned schools, I think that you need to know that we've had a very good working relationship with the superintendent, medical advisor, as I said, Dr. Kenefek, who's been really helpful, and the school director of nursing, Alicia Casucci, and we work and speak just about not just about every day, including on the weekends, going over cases and figuring out policies and who needs to be excluded and who doesn't. I know that they've worked so hard, even going so far as to reviewing videos of kids on school buses to determine who needs to be quarantined. I mean, it's been a huge undertaking, and I need to commend those folks and the work that they've done. And also, I want to say how appreciative I am for the cooperation that we've had with just the superintendent and his staff. It's been great. So what's next? Well, simple things like this is the time of year where we tend to, where we've always done food service permit renewals, talk about public health and the things that we used to do, talk about restaurant inspections. We have extended all current permits through May of 2021. Just the sheer extra work of doing 150 or so permit renewals at this time is just prohibitively difficult, especially since our admin is no longer in the office. So permit renewals are being extended. Hopefully by May, we'll have some semblance of normality, and we can then reissue permits again. But we're still conducting inspections. But before we do the inspection, we are actually doing surveys of facilities to ensure that staff are healthy and that we're going to have social distancing when we're in the facility inspecting. We have a small staff here and certainly don't want to put people at risk by doing inspections, though we recognize the need for us to maintain that presence in facilities on a regular basis. So we're continuing with that. Also with the cosmetology salons, and checking to make sure that they're doing what they need to do from a COVID standpoint and social distancing and not having places be overcrowded and maintaining the sector rules guidance that's, the 50% occupancy requirements, and that's subject to change. We're fortunate in that we haven't had to do enforcement, although we have now received the ability to issue citations and tickets, which we've never had before. I have a book of tickets here that I can issue with an infraction and a fine. And fining can go up to $10,000. So this is a huge, as they say, tool to try to gain compliance for places that are difficult. Our facilities, we're fortunate we have facilities that we've established relationships with. And, while there may be times when folks are not adhering all the time to the mask wearing requirements, they're quick to come around. So, anyway, so far we haven't had to issue any tickets, I'm pleased to say. And, with that, I don't know if you have any questions about our inspection program. Okay, then finally, I'd like to mention that we did hold flu clinics this year. for the regular old flu shots. And we did it strictly by appointment using the online scheduler. And it worked really well. And we were able to maintain timing, distancing. We held it in the gymnasium, as Nick said. That's one of the locations we've been considering using for our vaccine distribution for COVID vaccine. There's a lot of room in there. We set up 3 nurse stations, kept people apart, and we've given out 255 flu shots this year, which is pretty consistent with what we've been doing in the past few years. We still have vaccine left, so if folks need a flu shot, we can still administer them by appointment, again, by appointment only. And with that, I'll open it up to any questions that you might have.
I think David, we covered a lot of the questions that were submitted. So we went through a lot.
We did. Masks really work. That was the question. Masks really work. All the data have shown that this is an infection that's spread by droplets, and the masks contain droplets. I mean, they may not be perfect, but they have to be covering your nose, covering your mouth, and they will contain the droplets. Data has not shown that this virus is transmitted on surfaces of tables, countertops, or equipment. It's really live droplets and inhale because it's a respiratory illness primarily. So that's the method by which it's transmitted primarily. That's the social distancing issue. That's the masking issue. And in the off chance that you might touch something that somebody recently had live virus on, that's also the reason to wash your hands on a regular basis. I mean, it's simple stuff, but right now it's really all we have, and it'll help protect us from the regular flu as well. So, which, by the way, numbers are way down this year compared to other years. The regular flu, State Health Department is really not really seeing much flu activity at all so far this year.
Any other questions? Well, okay. Well, David and Nick and to David, all your just
Can anybody else hear him?
We're here.
I know Kevin just faded away.
We lost Kevin.
a great word.
My guess is what he was trying to say was that you and your staff have just worked an incredible amount to keep everybody in this town informed and safe, and for all of us, thank you.
Thank you for that. It's an interesting time, to say the least. Right, Nick?
Yeah.
Well, I don't know if we're going to expect to have Kevin back.
Kevin just posted in the chat. Thank you all. Thank you all. If there's nothing more, I think he's lost audio. His audio is cutting out.
I lost audio for a second, guys. Thank you so much, everybody.
Well, thank you, everybody, and let's hope everybody has a happy, merry Christmas, happy, healthy, Merry Christmas, and let's hope 2021 is a little bit better. Well, we're all here, so I can't complain too much. So anyway, best wishes to you all in the holidays.
Good here.
Thanks, gang.
I wish you all a
Thanks,
Merry
David.
Christmas.
Thanks, everybody. Thanks, Nick.
Thank you.
Thank you. Good night.
See you next year.
Okay, bye.
Thank you.
Thanks, everybody.